Hello, I'm Dr. Joseph Gnanaraj from DrLogic360, where your health becomes simpler and smarter. Let me ask you this. What if you could see the future of your heart before a heart attack ever happens? That's exactly what the coronary artery calcium score does. The calcium score CT scan is a quick scan that detects the presence of calcium plaques in the arteries of your heart. In the heart, there are three major arteries that supplies blood supply to your heart muscles. And in some patients or in some people, what happens is the cholesterol, particularly the bad cholesterol, gets into the walls of the arteries of the heart and gradually builds up. And eventually this cholesterol and the fat becomes calcified over a period of time. And then it could result in a blockage in the arteries of the heart, or suddenly it could lead to a heart attack. This calcium score test, or the coronary artery calcium score scan, estimates the amount of calcified plaques, which gives you the risk of developing future heart attacks or blockages in the arteries of your heart. So let's imagine your arteries in the heart as your highway to your heart. Okay. So if there are road construction work going on in the highway, if it is a small work, the traffic could still flow without having any problem. But if it is a bigger construction work, there could be impact on the traffic. The traffic may slow down. In similar way, if there are a lot of calcific plaques in the arteries of the heart, the blood flow to the heart muscles could decrease as the plaques keep enlarging. Or sometimes it could lead to an accident in the heart. We call it as an heart attack, which happens because of rupture of these plaques. So usually the rupture of plaque happens with a soft plaque, which even though the CAT scan cannot detect those plaques, but if there are calcified plaques, it also means that you will have those soft plaques, which could lead to heart attacks. Okay. So this calcium score estimates the amount of calcium plaques and tells you your risk of developing heart attacks in the future, so that you can take necessary preventive measures. Okay. So who should get these coronary artery calcium score test? First of all, if you have a family history, such as your parents or your brothers or your first degree relatives, your uncle or aunt, if they have a heart attack or a stroke, then you should consider statins, particularly if it is a male, if they have had heart attacks or stroke before the age of 55, or if it is a female, if they had strokes or heart attacks before the age of 65, then you should consider getting a coronary artery calcium score test. Or if there is a confusion about whether you should take statins or not. Let's say if your doctor states that your risk of developing a heart attack is higher and you don't believe that, and if you're confused whether to take a statin or not, then go for this coronary artery calcium score to estimate your risk. Okay. And who should not get these coronary artery calcium score testing? If you already had a heart attack or a stroke and you are taking appropriate medications like statins, then you don't have to do a coronary artery calcium score test, because you are already getting treated for that condition and you don't have to estimate your risk. You are already considered a high risk individual and you are already being treated for that. So if you have diabetes, or if your bad cholesterol is more than 190, which is the LDL, if it is more than 190, then you don't need to take a coronary artery calcium score test. Okay. So how would you get these results and what would the results say? So The result will come as a number ranging from 0 to, sometimes we have seen numbers up to 1000, 2000. Okay. And 0 means no plaque. Your arteries are smooth and the blood is flowing freely. So your highway is clean and the traffic is flowing smooth. And if it is 0 to 100, means plaques are starting to develop. There are some minor construction works going in your highway, and which is probably not causing any problem to the traffic. The traffic is still flowing freely, the blood is flowing freely. And at this time, if your score is between 0 and 100, your doctors may suggest lifestyle modification such as healthy food, exercising regularly, and then they may recheck your coronary artery calcium score in 3 to 4 years. Okay. If your coronary artery calcium score is more than 100, then your doctor may prescribe a statin with or without aspirin, depending on how much the coronary artery calcium score is and what your risk is. So, don't wait for symptoms to strike. Ask your doctor if coronary artery calcium score is right for you. It is not just a number, it's a glimpse into your heart's future. Because in heart health, early knowledge saves lives. Thank you for listening. This is Dr. Joseph Gnanaraj from DrLogic360, where your heart health becomes smarter and simpler. Got questions or thoughts? Drop them in the comments. I would love to connect. Remember, learning about your health doesn't have to be complicated. Stay curious, stay healthy. Thank you.